I don't want to have a knee surgery. I don't want to be out for 1 year. I'm a small business owner. I need to work, doc. What else can we do?
We have not come up with the science behind yet to kind of regenerate cartilage, but that would be helpful if we could.
Welcome to your daily health briefing. I'm Dr. Albert Takem. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. I had a patient who was told by a pain management specialist that procedures will not work anymore. It's time for surgery to have a knee joint replacement. And the patient came back to me terrified that I don't want to have a knee surgery. I don't want to be out for 1 year. I'm a small business owner. I need to work, doc. What else can we do? So I told them I had no idea what else could be done, but I know someone who can tell me. That's why I brought you on this show today.
Thank you.
So what else can be done for this patient?
So I have a couple patients like that who unfortunately have delayed surgery. They have other, extenuating life circumstances, and, they just don't have time to kind of go through the recovery period. So we do a couple things that say, hey, we only can repeat these joint injections like every 3 months at minimum. You're gonna kind of do your home physical therapy exercises. We'll incorporate some medications, if you will, but this isn't a perfect fix. At some point, it's time to have a conversation with the surgeon. All of these things that we're doing are temporizing measures, if you will. The underlying issue is that you don't have that protective factor or, support in your joints anymore, and the bones are not happy. So you need to see a surgeon.
So let's delve into the science. Why does the patient get to the point where they need surgery? Like, what has happened? What's gone wrong in the joint for them to actually need surgery?
Yeah, so a couple of things are happening. We talked about loss of the cartilage. We talked about bone-on-bone articulation, meaning that the bones are literally grinding on each other. There's no support between. And so you're constantly using that. And all of those things are really painful. You're not responding to steroid injections anymore. You're not responding to Tylenol. You're not responding to ibuprofen, which all of those things help reduce inflammation and help with pain.
Why can't the patient just get new cartilage in the knee? That's a question the patient asked me once.
They do, yeah.
Like, doc, why can't I just grow new cartilage? Why?
That would be, excellent. In a perfect world, we have not come up with the science behind yet to kind of regenerate cartilage, but that would be helpful if we could.
So in the current state of science, once the cartilage is gone, it's gone.
It's gone, yeah, unfortunately.
So what the patient needs to understand is that the joint replacement, be it of the shoulder, the knee, or the hip, is done because you are out of options.
You're out of options, right? So you need that artificial option to help simulate natural movement, if you will, so that you can continue to function and do the things you need to do.
Okay. So when we get to that point, very often the patient feels like it is their only option. In reality, it's truly their only option if they want to get back to a certain level of functionality.
Absolutely. Yeah. They're a new normal, if you will.
A new normal. Fantastic. And one of my patients who for a long time didn't want to get the surgery, a golfer, and he told me that after he got the knee, his game got better.
Oh, okay.
As well.
Okay, Tiger. Oh, wait, if we can't talk about him given the recent events.
So these are the benefits of having a joint replacement when the time is appropriate, because it really restores, the patient to their functional baseline. Fantastic. Thank you. So how do you guide patients like mine who are terrified of a surgery? How would you walk a patient through this process?
Yeah, so this is a common, question that I get all the time. And I've had patients ask, can you actually be there with me the day of surgery? And I say, hey, no, I can't. I will be here for you afterwards. We can still check in. And I say, even after your surgery, it's going to be a recovery period. The pain isn't going to go away overnight because now you have a surgery. You have to go through recovery. You have to go through physical therapy. And so we will be here for you kind of every step of the way afterwards. Okay. It's not something to be afraid of.
But you'll come out on the other side happier. a better version of you, at least physically.
Yes.
Fantastic. Well, thank you for walking the patients through this complex healthcare system.
Of course, Dr. Takem.
This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Takem, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.